Hi.
Hello, good evening.
Hi. How are you all? I just wanted to thank you for joining us, and I hope you have plenty of questions for us. What a difficult time we are all having, and it's obviously not business as usual. These are difficult times. We are very lucky that for now we are all healthy and our family are well. I hope your families are well as well. And please take care of yourselves. And
We've never done this before, so it's fascinating just seeing who's joining us. Hello to everybody, that's wonderful.
Oh, hello from Ukraine.
Yeah, Ukraine, we've got California, we've got... That's wonderful, wonderful.
It's so nice to spend some time together and somehow feel connected. So, hello, let's see if we have some questions coming in. Well, you know, Charles and I are not doing any operations at the moment. We are trying to support as much as we can in our own way the NHS, and what a great job they are all doing.
Yes, indeed. I mean, at the moment, a lot of the NHS work that is otherwise urgent is being taken on by some of the local private institutions, so we're available to help from that. And at the front end, obviously, it's tough, but I gather at UCLH they're building a whole lot of special ventilators. The Mercedes Formula One team have been involved in creating a CPAP type machine, so we wish them well, and let's hope that all comes to something good.
Hello from Scotland. Hi. And we are waving.
Yeah. Well, I'll try and wave back, so excuse me if we... There we go.
We don't want to sound or look too old in this technology, but I think we are doing okay so far.
Well, so far so good. Okay, I'll keep waving back. That's great. Good to see you all.
What...
Okay.
Oh, wait. Another opinion. I've wanted this for a long time, to have another look at another opinion in terms of...
Hey, I've been turned down for a nose job in Reading, as I have no obvious lumps or bumps. Would you be willing to have another look or another opinion? I've wanted this for a long time. Oh, I'm sorry to hear that, but yeah, I mean, sure. The question is maybe what are you unhappy about with your nose? And I think with any, we always say that with anyone coming to see us, please tell us what your specific issues are. What's your 1, 2, 3 problem?
Yes, that sometimes is the most difficult bit. A lot of us are like, I'm unhappy with this or with that, but what is it actually that I'm unhappy with? Is it the nose? And what of the nose are we unhappy with? A lot of people are also asking about the different types of rhinoplasty, and whether those rhinoplasty types, preservation rhinoplasty, structural rhinoplasty, diamond rhinoplasty, rhinoplasty or septorhinoplasty, it's not for any of you to know the different types. It's just for us to explain to you those different types are there. And we have responsibilities to select the best type for you, the one that gives you the outcome that you want with the least risks.
So we've kind of been innovators in a lot of the modern technology and the techniques, and all we're doing is putting that out there and showing you examples, and we're the best people to advise you about what's right for you. Now, somebody's just asked us a question about e-consulting and MacBook Airs. I think that problem has been resolved by top doctors. So we are available to do e-consults. Do contact our PAs if you want to set one up. It works pretty well, and obviously we can't look at the inside of your nose, but we can get a pretty good idea about who you are, what you want, and then obviously arrange a follow-up consultation face-to-face when we're allowed to.
Yeah, so I think the MacBook Air problem has now been resolved. What's the difference between rhinoplasty and septoplasty? Okay, well, very different operations. Do you want to answer that?
Yeah, I think this is a slightly... Well, I mean, okay, there's one thing. Rhinoplasty is anything that changes the outside shape of your nose. Okay, so that's what that is. Septoplasty is very specific to the partition that sits down the middle of your nose. Okay, and septal surgery is part of almost every rhinoplasty. So, in general, if you've got a very, very deviated septum at the front of your nose and a restricted airflow, and you want to breathe better, a septoplasty may help you. But anything to do with the change in the outward appearance of your nose is a rhinoplasty.
Or the septorhinoplasty.
Okay, yes, of course. Joining the two together, of course, they're often done in concert. It's a slightly artificial distinction, but I hope that answers the question. Now, where are we?
Lots of waves, which is really sweet. Thank you.
Oh, yes, I highly recommend Rhinoplasty. Thank you so much.
Thank you.
That's very kind of you. We love you. Okay, I have a smaller nose, but my small bump makes me insecure in pictures, and the tip could be lifted. I've heard you're the best. Would you look at smaller noses to remove the bumps?
Yes.
Yeah, of course, whatever creates the right balance in your nose shape for your face. And if your style is you want to have a lower bridge and a slightly higher tip, of course that's possible.
I'm a bit confused by the different types of rhinoplasty you talk about on Instagram. Am I supposed to know which one I want before I call? Definitely, you don't need to know which rhinoplasty you want before you call. What you need to know is, well, what is it that you are unhappy with? And we can then advise on what's the best for you. Oh, Charles is really good. Thank you.
That's very sweet of you. Thank you so much. Thank you. I appreciate message sent through. Oh, that's good. How many operations have we performed?
Oh, have we performed? Well, I'll start because I don't do as many, so I do 2 to 3 a week.
Okay, and
on the weeks I'm here. At the moment, none.
I'm trying to tie it down a bit more. No, so on a busy week, then I'll probably do 5 or 6 rhinoplasties. And how many have I performed? Gosh, I stopped counting after 3,000 some years ago. I kept a fairly accurate record, but anyway, lots.
Yeah, lots.
More now than I care to remember.
Shows your age, don't say
that. Okay. Oh, there's Rhino Istanbul. That's a good friend of ours. Hello.
Hi, Voxel.
Good to see you. Who's that? Danielle. What are the chances?
Hello, Isabella.
Let's wave back. Let's wave back. There we go. Chances.
What are the chances of the aesthetic not working?
Anaesthetic.
Oh, anaesthetic.
Difficult. It's against Lydia's white top. She couldn't quite see it. The chances of anaesthetic not working during the surgery, well,
that's never happened.
0 with the type of anaesthesia that you're given. I should just sort of go and explain that a bit more. There are certain types of anaesthetic where your body's paralysed, and certain types of anaesthetic where you're breathing naturally and have a drug administered in your arm. Now, with all of our specialist anaesthetists, it's impossible to be awake or conscious during rhinoplasty surgery. And I'll just add one other rider to the safety, because I worked in the States and part of my training. I did 100 rhinoplasties under local anaesthetic, and I vowed never to do any more under local anaesthetic apart from small things, because the safety now of anaesthesia and the conditions and the environment that gives us the best chance to give you the best nose.
Safety.
Safety, yeah. So safety is our first priority. So I would reassure you that your risks in anaesthesia are really, really small if you're fit and healthy. Occasionally people can be sensitive to some anaesthetic agents, but that's very uncommon. It's happened in our practice and we've always been able to resolve it and sort it out.
Quickly and efficiently. We work with an amazing team of anaesthetists. They've been with us for as long as I can remember. So we've got a team of 4 anaesthetists and they are wonderful. I would trust them with my daughters. In fact, I have trusted them with my daughters. They are brilliant professionals.
What are the pros and cons comparing DCF, I think that means diced cartilage in fascia, and normal rib cartilage?
Well, that's very professional.
Someone's obviously got a little bit of inside knowledge here. Well, they're both forms of graft. And a graft, in simple terms, is when we take a little bit of tissue from one part of your body, maybe from your nose, from your ear, or from the rib, and we use it somewhere else. And the diced cartilage fascia is a bit like a sock which we put with little bits of cartilage that are chopped up into tiny pieces. So it's quite flexible and malleable. Rib cartilage is usually strong and quite straight in most places. And we'll use that for a foundation or something that's structurally rigid. And the dice cartilage fascia is often used as a little bit of icing on the top to give a nice smooth contour. So they're both different types of grafts, and they're applied in different circumstances.
I hope
that answers it.
A bit complicated.
Get out of my head, yeah. Okay, so we've got some more waves here. A botched nose.
Oh.
Lydia, you're so pretty and have a nice smile. Oh, I know, she is.
Oh.
She's wonderful.
Oh, thank you, botched nose, but don't call yourself that.
No, think of something good.
I have to say, this is a very difficult time for everyone. And all of us find different things more difficult. Obviously, having a relative who is unwell is the most difficult bit, but what I find most difficult is not being able to plan.
Yeah.
I'm such a organized planner, and on that day we'll schedule, we'll do, and to not be able to do that has been quite frustrating. I find that difficult. I've had a very bad primary. Is it possible to fix and invert the scan on the columella? Columella is the skin in between the nostrils. My once lifted tip is now droopy.
Sorry to hear that, Emma-Louise. Yes, I mean, I think the key thing in rescuing a bad operation is your skin okay? So if the skin hasn't been damaged or the skin envelope, then by and large we can use one of the grafts that was mentioned earlier to put that framework back, give you the strength and support that you need, and allow your skin then to adapt a nice new shape. And the best thing to do is to basically take some pictures or come and see us, because that's a very individual issue. But as long as your skin's good, most times we can usually improve.
Yeah, Charles is very experienced in revision rhinoplasty, which is what you're talking about, but hopefully you would like to avoid being in that position and kind of get it right first time.
How successful can a tertiary rhinoplasty be?
Well, it depends what success means, huh?
In general terms, you know, I'm sorry if people have had unsuccessful surgery. It happens, you know, and it happens to all of us at some time. Successful really depends on what those specific deformities are and what your goals are, and how happy you are to accept an improvement over perfection. Because let's face it, I know you're very good, Lydia, but neither of us can really sometimes ever get perfection. We can always things look better, natural.
It's an ER, better, straighter,
clearer,
more balanced,
prettier.
Have you had much experience with male bulbous tip rhinoplasty? Yes, we are both experienced with
absolutely, that. Absolutely. Can you do morphal consultations from the front or oblique views? Yeah.
Yes, it's not as powerful, it's not as dramatic, but it's definitely possible. That's actually one of the things we were thinking with the virtual consultations, how to be able to give more information on possible outcomes. So that's at the moment, we are working on it, but at the moment that's proving a bit of a challenge, just because the type of photography that you can send us is not really, no matter how good it is not as good as the ones.
Yeah, watch this space. We have got something that's probably going to come along that will certainly give you a framework or an idea. And of course you can do your own morphs. There is that Facetune app which you can have a go at tweaking yourself.
A lot of
try it. You've got a bit of spare time, so try it.
Can you remove bumps through a closed
Yes.
rhinoplasty? Absolutely.
Absolutely, no doubt at all.
This is really fun.
And I'll see you in London when this cry. Yes, hello Neil, of course you will.
Looking forward to it.
Yeah, take care of yourself. Had filler in my nose and now want a nose job. What should I do?
Wait.
Well,
I would say wait. Wait, because we cannot do it now. No, I'm joking. Well, if the filler has given you an improved appearance, that's great. It's a temporary fix. So once the filler has resolved, we'll be able to see you, and us will be able to see your issues and the different problems that you would like fixed. there is no hurry at the moment, so I would say wait. It normally, in the nose it stays for longer than in other areas of the face, but probably 9 months or so from when it was first inserted.
Okay, that's Dr. Miguel Ferreira. Hey, that's
Hi,
Portugal
Miguel.
on phone. Hi.
Hi Sarah. I love it when we can actually see the names.
Worried about developing an inverted V post-rhinoplasty. What to look out for?
Good question.
I
We
wonder-
are worried as well. We don't want that.
That's the inverted V. For those who are not aware of it, is a funny shadow that appears across the middle part of your nose, and it can happen if you've had a rhinoplasty where the hump has been cut off, and then the side walls are just moved together. What happens is you've got a little sinking in this middle third, and it creates an odd shadow, and so the aesthetic lines from your nose to your tip look interrupted. Well, it's up to the surgeon to prevent that. The thicker your skin, the less likely you may see it. And also, you may have heard us talking about preservation rhinoplasty, which is where your natural bridge is just lowered and dropped. And this is one of the ways where we can almost guarantee you won't have an inverted V deformity. I got a botched nose by a famous Harley Street surgeon. Oh, who's that, me? Please, can you help me because I look like a monkey now? Oh no!
I think we need to have a chat. Perhaps we don't know your name, but
no. Please contact us and we'll talk things through. But yes, is it possible to come to you to fellowship? Well, that's a good question. We have many visitors. There is no formal fellowship program, but. And we don't really have the ability to offer observerships, but people can come with advance notice and watch surgery. We've got several specialists who people have done that with. You can contact the London Clinic if you are a doctor and want to do a fellowship, because they run one of the programs. But otherwise, it's not something that we're set up to do at the moment. Okay, you'd like to answer this one?
Yes, difference between a closed and an open rhinoplasty surgery. Very easy to answer, really. Closed or open is the approach. It means how does the surgeon get into the nose to be able to do the operation. Closed is when there are no external scars, so all the cuts are inside of the nose. And open, they are inside of the nose as well, but there is an extra one which is in the skin of the columella, you know that name now, which is the skin in between the nostrils. We, i.e. the surgeon, the professional, would really decide what the best approach is for the type of issue that you have. We would prefer closed if we can achieve a good result for you, but if the result is going to be better with an open approach, so be it. So I know open and closed approach has a lot of weight on it, but I would recommend that that's almost the least of your problems. Don't tie our hands, but if you trust a professional, be it us or be it another one, allow them to be free to give you the best results in their hands.
I think that's exactly right. And we will always give you the advice about which route we think is the best to minimize your risk and maximize your outcome.
Hello from Russia! How is it in Russia? One lovely thing about this, if we are positive, and there is one lovely thing that this current situation is bringing us closer to friends that we wouldn't otherwise necessarily talk to. We cannot see them, but I spend a lot of my time these days making sure all the friends, people we know, are all right. So hi to all of you.
Here we go. Look, what made you choose getting into rhinoplasty, choosing to be a surgeon? Lydia?
Oh, Well, that decision happened quite a long time ago now, and so I come from Barcelona, and I came to the UK to train as an ENT surgeon. And ENT surgery is a wonderful specialty. It allows there is a medical side to it and a surgical side to it. I absolutely love doing operations, but there is a medical side to it which brings people. There's a proximity, there is a closeness to it, and the chances of following it up. And then maybe in 2001, within ENT, I very much then specialized in nose, anything to do with the nose. So since 2001 to 2020, just that 19 years, I love rhinoplasty. It's a bit crazy, I don't know. Sometimes it's a bit obsessive.
Yeah, I think you either have to do it or don't, and it's one of those things that we both love. You know, we've both innovated, we've lectured, we've taught, we've published on it. So it does become a bit of an obsession. But one of the things that happens over time is that you start off doing lots of operations, and then you end up doing fewer and fewer.
I have to say something, because my mother said so. You went to medical school, university, then you trained as a junior doctor for God knows how many years, then you became a consultant, and now you just deal with the nose. Like, what is there to do with the nose?
Oh, I love her mum. Her parents are so great. Botched nose, hello again.
Are you able to attach the foot plates onto a dual septal extension graft to reveal my columella and infratip? Well, that's...
Very specific.
Very specific.
You need to come and see us. Please.
Please make sure you know what you want to achieve rather than giving the surgeon the technical details of what you need.
Katie Bell, top doctor said they're not compatible with that MacBook Air. Okay, well, I will recheck with them.
I think that's been fixed.
They did tell me that it had been, yes, it had been sorted.
Find
We'll recheck and confirm that. If nostrils widen while smiling, is it possible to fix that? That's a really common request. I don't like my nose when I smile; it goes wide. We can that's caused by the little facial muscles, and depend on how active they are, you can release them. You can bring the nostril base in so that the nose is less wide, and you can do that sometimes non-surgically by trying it with a little bit of botulinum toxin. So
very effectively.
It's possible to do that indeed. Can you make nostrils smaller? Yes, you can. You
Absolutely.
Can. Indeed, it's possible to do that. Press Natalie. Okay, who have we got here? How to achieve a more masculine nose? Well, that usually means adding something, making it stronger, straighter, a bit more projected. That often needs a graft to do that. Surgically or non-surgically, it can often be done by injectables.
Injectable, which is actually... I would say...
And here's our next question. Are there any filler injections available that are permanent?
There are, but we don't use them.
Yeah, and I think you've got to be a bit careful with that one, because all injections have a risk, and what you don't want to do is have something that is irretrievable. So we don't use permanent. We do use a collagen stimulator, which has an extremely long duration and converts basically you to make your own natural collagen. So that almost becomes permanent.
Permanent, but with your own tissue.
But with your own tissue.
Which is even better.
Yeah. How many surgeries do you perform a day? Well, gosh, at
the moment?
No, 0. At a push, I might be able to do 3, but then I'm on my knees at the end of the day and I've got no words left to talk to my wife. What's your success rate?
Yeah. Thank you so much, Danielle, for your lovely words. We think we are. Success rate, again, it depends what success is. How many times is the patient you happy? I'm happy to say a lot of the time we make people happy and achieve what they want. There is always a risk with surgery. Everybody knows that. And 8 out of 100 patients, 8% would need a little tweak. So things have gone well, but they want a little bit more or less, which is often the case.
Is it possible to add a small bump to the bridge where it was overshaped? Yes, of course. That can be done surgically or non-surgically. A few more waves here.
I love that.
Hi, I had a rhinoplasty 2013. I hate the way it looks, but everyone says I'm looking for perfection that doesn't exist.
Oh, yeah, that's often...
That's often expectations that is a difficult one. Depends really what you're unhappy about, because actually one of the most important things is, even if you have little imperfections, and remember, in the normal population we're all asymmetric, we've all got little imperfections, but if you project a happy face and a wellness from within, those things seem to disappear. So perfection,
difficult though,
yeah,
but perfection doesn't exist, that's for sure.
I don't think it is, but happiness or well-being or being comfortable in your skin, I think does. Can you explain why our patients don't have that horrible old-style bruising after surgery? Well, yes. Well, okay, many reasons for that. And the first starts before the surgery, that there are certain things that we want you to avoid, which thin your blood and can make bruising more of a problem. The second thing is how you go to sleep, is the type of anaesthesia that's given to you. And that includes a local anaesthetic infiltration as well as the general. And then probably the biggest reason now is how we do this operation. And we pick a plane of tissues where we go, where there's very little trauma. The technology of the diamond rhinoplasty has made a huge difference to how we can move and mould bones, but without shattering with a hammer and chisel. And the care of your tissues when we're asleep. So with experience over time, we've evolved to techniques that you can look very good at day 7, and certainly by day 10. Minimum risk of black eyes. I don't know about you, it's very rare for us to get horrible sweat. This doesn't happen.
So diamond rhinoplasty, which Charles has alluded to, is by a technique which is an ultrasonic technique, rhinoplasty, which means it's a piezo technique. So there are 3 words which mean the same thing. And with this technique is the ultrasonic waves that drive the material that we use in the nose, and that's way less traumatic as well.
Yeah, there's constant irrigation as well, so you just don't get the same degree of tissue reaction. That's down to our colleagues in the little International Rhinoplasty Research Society, of which we're both very active members, and it's helped pioneer a lot of the modern developments.
Can a rhinoplasty improve breathing issues?
Yes, it can. It can. Depends on which part of your nasal valve is compromised. If you've got a bent nose or a collapse on one side here, having a rhinoplasty can certainly improve your breathing.
Are there any filler injections for your nose that are permanent? No, I think we've answered that. Thank you. No, we don't use anything permanent in the nose.
Do you have a long wait for face-to-face consultation? Oh.
Well, if only we knew.
It's frustrating, I'm really sorry. As soon as we kind of get a feel for how this lockdown is going to unwind, then of course we will start reconsulting. So our waiting list, well, at the moment we can't say, but stay in touch with us. We'll post and publish on this.
Not a question, but wanted to say to who is watching that those two are the rhinoplasty team and are the best. Isabella, you are the best. You are such a wonderful patient.
Oh, sweet.
Thank you, Isabella.
Oh, we've emailed you. When do you get back to me? Okay, I'll chase it up with our PAs. We're all working remotely at the moment, so we had a team meeting today, but we'll get back to you, don't worry.
We never use any permanent sutures in the nose.
I have fond memories of you. You made my dreams come when I saw you 20 years ago for a breathing issue.
Oh my goodness.
And a large nose. And I still to this day talk about how wonderful you are. Oh, look, Rockstar 789. You've got such a big fan club.
You are a rock star. Rock CK.
She is wonderful. Everybody loves Lydia. Everybody.
Thank you, Rockstar.
If you could tell us more about diamond rhinoplasty. I think we just went over that. I think preservation rhinoplasty. Diamond rhinoplasty is the ultrasonic part. Preservation is a philosophical approach that we now want to preserve as much of your natural tissues as possible. So that is, there's very little cartilage resection. It's preserving your bridge. It's preserving the tip cartilages, but reshaping them, rechanging them. And it's protecting all the natural ligaments in your skin and skin envelope. So that's made a very, this is what we believe most rhinoplasties should be done with this philosophy.
Yeah.
So preservation means not cutting the hump off, not taking out all the tip cartilages, not turning your nose up by cutting the septum away, and not taking huge numbers of grafts from your septum to put around the outside.
It gives the most natural result.
Yeah, we think it's the best way to approach most primary rhinoplasties.
Oh, prices! We were expecting that question. There is a price, and all the prices have a breakdown of 3 fees, which is the fee for the surgeon, the fee for the anaesthetist, and the hospital facility charge. The 3 fees altogether, it starts from £9,000.
Fair enough. Another question, what would be expected of me to get the best results?
That you follow instructions.
Yeah, I mean, I think we've done this many times. We talk about it both at work and at home. And I think one of the issues is we kind of set out programs that we know are going to work. So the instruction guides we give you and the literature, please read it. Try not to cut corners. We give a reasonable time frame for what each step should be. And I think if you follow that, you'll get the best result for yourself. Obviously, things like smoking are not good around the time of surgery, and making sure your nutrition's healthy, and particularly at this time of year, your vitamin D levels are up, because most of us in the winter don't have enough. So vitamin D level we think is important in terms of you healing yourself. My smile has been affected after septal rhinoplasty performed years ago. A crease when I smile. Could it be related to the columella strut? Yes. That's not uncommon. No, that's right. So when you get the smile and it pulls here, you get a little wedge. So that can be released. A little bit of botulinum toxin will stop the muscle contracting there. Or if you can feel a hard lump, then that can be reduced quite simply. And that's almost a local anaesthetic type procedure to do that. Do you ever do consults in the States? Have done, but no.
I've never done that.
I used to have a state license in Washington, in Seattle, but I'm afraid that's lapsed. So sorry, you've got to come and see us over here.
Or virtual.
Or virtual. Lydia, your skin is glowing. What do you use?
Oh, well.
I'm just going away. I'll be back in a few minutes.
No, another amazing thing nothing amazing is happening. One thing I am doing is using quite a strong retinol product. Some of you know we don't have any shares unfortunately, but we recommend the range of Rhinoplasty. And for those of you who have oily skin, they follow a program before surgery and after surgery to get better results. And within that range, there is quite a strong radical night repair, quite a strong 1% retinol, which I've been using for the last 3 weeks.
She's glowing.
I'm glowing.
Absolutely glowing. Yeah,
but my Botox is wearing off.
But just on that point, actually about skincare, because that's another facet that we've learned from a colleague in the United States, about incorporating that into rhinoplasty into your program. So we'll often precondition your nose. We will certainly help you with that oiliness that happens to everyone in their nasal skin, particularly the tip, after surgery. So skincare is actually quite an important part of our process, not only for the nose, but generally for your face.
For your face.
Do you do closed? Yes, we do. Can you alter the tip of the nose? Yep. We can lift your nose tip up in a closed rhinoplasty. Have your prices for rhinoplasty increased? Don't think so.
Not really in the last... When was the plus review? I mean, we need to talk about business going forward and so on. But the last price review was last summer. Yeah.
So for our primaries, it's pretty much the same. For secondary rhinoplasty, they're kind of quoted individually, depending on what we need to do. Secondary rhinoplasty is obviously quite complicated. It takes longer. And it's more difficult, so it attracts a higher price. I understand that the use of steroids can be used in post-operative care. Why are they used and what are the side effects?
That's quite a good question. You're right, sometimes we use a steroid, it's called a Kenalog. And steroids, as you know, generally are good for inflammation. So if there is excessive inflammation within the different layers of the skin, a limited injection can help. Typically, the place being not in the tip, but right above the tip area, so that if that swelling goes down quicker with the injection, you achieve the desired result a bit sooner.
Yeah, so there are very few side effects with the dosages we use, and it's often dependent on your skin type as to whether you need a steroid injection or not. So if you've got a thicker envelope where there's like a duvet that's become puffed up and pudgy, then the steroid can actually make quite a big difference in helping your skin to reconfigure and reconform. Looking forward to my virtual consultation tomorrow. Okay, perfect. Well, we look forward to seeing you too, Sarah.
See you, Sarah.
Can a tip that only droops when I smile? Yes. So the
It's
dynamic,
a common issue, actually.
How long before, to go back to full contact sports? I appreciate the contact sports are not ideal. Okay, so if you've got a dynamic nose, that is where there's
A dynamic nose.
well,
Yes.
droopy tip sounds a bit sort of.
No, dynamic nose is better.
But a dynamic nose, so that when you smile, the tip appears to droop down. Actually, what happens is the sidewalls tend to pull up more than the tip droops. That can be changed by changing the position of your tip and also sometimes releasing the pull of the muscles. It never completely stops it, but it makes it much less. Back to sport, well, we say for full contact, normally I would say 6 weeks before you, and then your nose isn't still fully healed, but it's pretty strong by that time. Depends on what contact sports you undertake, of course. Who does the most complicated rhinoplasty?
Hello, Queenie. The king.
Well, yes.
No, in all honesty, it's a genuine question, sorry. Not uncommonly, we operate together. And when there is a very complex rhinoplasty which requires a lot of the grafting from the rib, it's actually a really useful thing to do, to be able to do the case together, not just in terms of helping for the actual operation, but sometimes one can be a bit more objective than the other in terms of what is looking good and the techniques. And so we not uncommonly operate together.
Yeah, I think that's true. Actually, another pair of eyes on this, because after 3 or 4 hours, you get quite fatigued and sometimes not sure. So it's really helpful to have Lydia around, and all of my other staff as well. They're just,
in fact, the
whole team are great.
The team is, so that you know, it's quite big. So when we are in the operating theatre, it's a minimum of nurse assistant together with the runner 2, our assistant 3, 4.
So that's Julia, our clinical nurse or fellow.
The anaesthetist and the runner for the anaesthetist 5, 6, and the most important person, the patient. So there's 7 of us minimum.
I like the ladies now. Has she had a nose job? No, you mean Lydia? No.
My nose? No.
It's natural. Totally natural. Hello, both are amazing. Thank you very much. I had a very long wait to have you consultate. I've done it elsewhere. The result is really amazing, but after septum, I'm thinking septum is still deviated. Okay, well.
I'm so happy you had a good result.
Yeah, that's important. Is that possible? To look straight and pretty from the outside? But yeah, that's possible. And if you don't have any problems with your breathing, you probably don't need to do anything more about it.
I would say if you've had a successful operation, to have a deviated septum may not be the end of the world. Most of us have a deviated septum and it doesn't contribute that much to any problems.
Your clinic comes across really caring and genuine. Are you both specialists? Yep, we are. Yep, sorry, we're both registered fully rhinoplasty specialists. With
all the societies you can imagine: Rhinoplasty Society of Europe, European Academy of Facial Plastic Surgery, International Rhinological Research Society, Rhinological Society of Europe,
Facial Plastic
Surgery UK, and I think I'm not missing any of them.
Yeah.
What do you think about non-surgical rhinoplasty? Do you think you can get similar effects? Or would you say surgery is always the best option? Well, there is no best option. The best option is what is best for you. I think the
Just took a shot at the garden there. Pushed the wrong button.
The best option is what's best for you. So I wouldn't say one option is better than the other. It may be that non-surgical works well for what you want to achieve, or surgery works better for what you want to achieve. So it's got to be very individual.
Don't have an issue with my nose. I have a pitted scar on one side. So side is not... Okay, that's something... I don't know whether that was from chickenpox or from an acne spot or something, but that's often helped with subcision. That's a little needle underneath the skin to evoke a little bit of an inflammatory response, and either
a collagen stimulating filler is perfect. The same with acne scarring.
Mm-hmm.
It's shown to work very, very well. It's an injectable. There are two types, in fact, in the market. One of them is called Elance, but it stimulates your own collagen. So for this scarring within the nose or anywhere else on the face, it works really well.
Someone who's a fan of Barcelona.
Oh, did you enjoy it? I love it. Oh.
Yeah, my wife's an ENT surgeon. Thumbs up to both of you, and to her too. Hope she's staying safe in this COVID period, because ENT people have a high risk of acquiring this disease.
Hi, Yanis.
Thanks again, Lydia. There we go. How do you know if you've broken your nose?
Oh, you know.
You'll know. You'll hear a crunch. It'll swell up, and you may get a nosebleed.
Mm.
Booked in for surgery at the end of April. Do you think this will go ahead and cancel? Hi, Runner Dreams. Yeah, well, we're talking about that today. We hope by the end of April that there is routine surgery going ahead. We're scheduling for that, but please just watch this space. As you know, it changes from day to day.
Yeah, we don't know.
My final question. I feel apprehensive towards scheduling an e-consult. I'd much rather wait. How long approximately will waiting times for be?
Well, at the moment, again, if only we could tell you for sure and make some plans. Face-to-face is always traditional, it's always better. I think all of us will have to adapt to a different way of working. If you really want to wait, obviously this is not an urgent thing, so you're very welcome to wait. We are looking at the summer, hopefully June, July, to just give you a rough idea, but no one knows.
Thank you for asking my earlier question. Hi, Emma Louise. I've just one more. If your lip muscles have been altered in primary, can they be fixed during the secondary? I now have a much bigger gap. I presume you mean from here to here. Yes, you probably need a form of lip lift together with, if your nose is good, great. But if the lip's long, it needs a form of lip lifting. But yes, we're happy to do that. I have this too. Okay. Why my inner corners of the eyes move after rhinoplasty when I breathe in air. Oh, that's interesting.
I've never heard of that happening.
That usually means if there isn't a solid part of the nasal framework there, that the lining of the nose and the skin on the outside are in communication. So if you can feel a little gap or a hole, as you breathe in, it causes a little change in the pressure. So that's maybe why you're seeing some movement. I presume it's here.
When you blow your nose, do you get a swelling? Just a thought. Oh, who is the best surgeon? You mustn't.
There's no doubt. Look at her. I mean,
who is the best?
It's difficult.
Definitely the king.
How many days off work do people normally need after surgery? We normally recommend about 10 days. So,
minimum.
Yeah, for the first week you wear a plaster cast, and then that needs to come off, and there's a little bit of skincare. You need to get used to your nose for a day or two, and just the crusty little bits and the dryness inside to settle. So minimum of 10 days. How do I decide which one of you I should choose for surgery?
Choose Charles.
Depends whether it's primary, secondary, complicated. I mean, we're often consulting in the same time, but if we feel that we're not right for you, then we'll often discuss it with each other. So, I mean, come and see us and you can choose. What would someone like? Okay.
To do residency. Hi, Mariella. I don't know if you work here in the UK. There are many places in Europe that offer very good residencies, or whether you are based in the US. Maybe just drop us an email and we can see where you're based and where to go. We'll give you our recommendations. We know lots of professionals internationally.
It's Hey Bum saying 6 months post-surgery, best thing I've ever done. Yay, good on you. Right decision. Recommend rhinoplasty to anyone whose life it affects in a negative way. Good. Nice to hear that. We know that, I think, when you get it right, that inner happiness, that projected satisfactory image there's no way to measure that easily.
No.
But you can tell it straight away.
Yes.
You can tell it. So I'm really pleased for you that you feel that way. It's wonderful. Can you use diamond preservation rhinoplasty revision? Well,
separate the question.
Yeah, so diamond rhinoplasty, yes, is very useful for resculpting and reshaping bones if there's irregularities or bumps without having to re-break them. Preservation techniques, well, it depends what was taken out the first time round.
The concept of preservation is more preserving your natural nose, the good things that your nose has, changing them, but preserving a lot of the anatomy. So if you've had surgery already, a lot of the anatomy may not be preserved anyhow, so it's difficult to preserve something that wasn't preserved before.
Yeah, so I mean, we normally say that's preservation is kind of an approach we do to first-time operations, and that's why we try and get it right first time. What's the solution for thinned or pushed-in nasal sidewall for ethnic revision? A thin sidewall, like, okay, Middle Eastern people. Well, if your sidewall's being pushed in and the bone is literally too far towards the midline, then that will need to be moved back out, and it probably will need to be fixed with a form of graft. If it's purely just a contour problem, then a non-surgical solution would work, an injectable, to just change the contour shape on the outside. Hope that answers your question. How long does surgeries take on average? For anywhere between 2 and 6 hours.
Yes, majority of them 2.5 to 3 hours.
I think that's an important point just to say, because
yes.
If you go to see someone who says, oh, this is easy, your operation could be done in 30 minutes.
A lot of damage can be done in 30 minutes.
A lot of damage can be done in 30 minutes. So, modern rhinoplasty is a very detailed, specific operation. So someone who says, it's a quick one, don't worry, just think again, have another opinion perhaps.
This is going to change the way you look. It's something on your face. I always feel, goodness, I wouldn't want someone taking 20 minutes in changing something which is going to be with me for the rest of my life.
Yeah.
Think about it.
What's that aphorism we come up with? Something there's nothing more expensive than cheap advice.
That's your aphorism.
But it's true. Do you use micro-precision botched nose again? Yes, we do. Indeed.
Do you deal with septal perforations?
Yeah,
septal perforations are difficult problems.
Yeah.
It depends on the cause for the perforation.
And what symptoms you're getting from it.
And exactly that.
But yes, we
do. If it's giving you problems.
If you have a runny nose on the day of surgery, would you go to rearrange? Not necessarily. I mean, if you're starting a cold or an illness, then obviously we'd postpone you. But if you've just got a little bit of congestion or mucus, not normally. That's down to the anaesthetist, really. More important about your chest.
I would say on the runny, if you do suffer with allergies, if your allergies are seasonal, I'd say considering surgery during an allergy time is probably not a good idea. But if your allergies are perennial, obviously you have them all the time. So then I would recommend some allergy treatment well before the surgery so that you don't have a runny nose.
Yeah, I did a little post on allergy because that's another reason that people have to touch their faces a lot in the allergy season. So make sure you're starting your treatment early, wear glasses properly, Wash your hair at the end of the day so you haven't got pollen still in it. So all those things that minimise the irritation that pollens cause. I've had keloid scars in the past. I'm sorry to hear that, Nat 90s. Have you had any cases where keloid scars developed in an open rhinoplasty? If I get one, it will be the first one ever published in the literature. There is something peculiar that is different about this nasal skin, that it never keloids.
We don't understand why, but it's never been reported.
Never ever been reported. It won't happen to you. What made you want to be a rhinoplasty surgeon?
Now you answer that now.
Well, again, I have a very broad training, and I used to do complicated head and neck stuff for a long time, and I always had a fascination with the nose, and over time it kind of evolved. The thing about rhinoplasty is you never quite stop learning how to do it, so it's always been a challenge, and it's a challenge that it's that operation that got me. So it was a fellowship when I worked in Seattle with Dr. Wayne Larrabee, who was a very, very well-respected surgeon, charming guy who really opened my eyes, and I was a co-fellow with Dean Toriumi, who's a very famous rhinoplasty surgeon in Chicago. And between the two of those people, they made me realise I knew nothing about this operation, and it started on my fascination, and it's never stopped from that. So that's many years ago.
No, not that long.
How much is a consultation? Well, it's about £300 to see us face to face, or £200 if you want to have an or a video consult with us. Okay, what can be for retracted alar rim non-surgically? Ooh, that's difficult. Alar rim is this tissue here
It's a difficult one.
Yeah, it's not like normal skin. It's very difficult to change that by an injection. So by and large, that usually means that something's happened to the frame of your nose, which is why the notch or the retraction has occurred. And that little scar needs to be released, and you need to put an additional graft in there. So I think non-surgical is very, very difficult to get a predictable, good result.
And it's risky.
And it has a risk. It's one of the risky areas we don't like injecting. Thin side walls. Well, building it back up again. We talked about that, moving your nasal bone outwards, or...
Do you make 2D or 3D morphs, please?
We do 2 routinely. If you want to have 3D, that's possible to be arranged. We don't actually physically do it, but we refer you down to the 3D scanning department. I lectured on this several times. I still have a feeling that for rhinoplasty, it's very difficult to see the big advantage of having a 3D scan over a 2D.
Yeah.
Are you able to widen my dome's botched nose? Gosh, botched, you do need to come and see us. Can you save this video, please?
Yes,
yeah, sure.
Definitely.
So, thank you for the informative session. I have to log off now, but counting the days till my consultation. Okay, bye-bye.
Look forward
Stay
to
safe.
seeing you.
Stay safe. Good,
I think
good that
we
you joined
might
in.
need to... I don't know whether we are towards the end.
We are. We've got about 3 or 4 minutes left. What's the waiting list for surgery once you've had consultation? Well, normally, we can operate you within about 6 to 8 weeks.
There's not much wait.
What's the waiting list for surgery after consult? I just answered that one. Good idea to get an iron infusion. Okay, iron infusion. Correct any anemia. Make sure your vitamin D levels are normal. So those are the 2 things I would recommend. Doctor, happy to see you. Can you play open book techniques to fix deviated nose? Okay. I think that's my question, isn't it?
Dr. Fairchild, you have heard Charles lecturing before, right?
Yeah, so it's a way of which we can move the 3 layers of your nose. So you have one outer wall, a septum, and an inner wall. And if they're leaning like this, you move one wall vertically and bring it down slightly. You move the centre part over as a second page of the book, and the third page of the book closes.
That's for deviated noses.
You'll see several of our patients who've had that open and closed book procedure up on our Insta, but otherwise any more, well, maybe log into the IRS live chat on Wednesday.
On Wednesday at what time is it?
Well, it is 6 o'clock on Wednesday GMT. So that's myself and the rest of the group of our International Rhinoplasty Research Group.
But that's for doctors only.
Yeah. Thank you so much, Forthium. Oh, Milan. Gosh, stay safe in Milan. You poor people there.
Stay strong.
We missed there. We were supposed to be in Bergamo in March, but anyway, our hearts go out to you. Can you get dermal fillers after rhinoplasty? Yes, of course. Filler Meadows 2 years ago, and those looks completely different before filler. What are my options?
That's
okay.
Strange.
I wonder what's changed. Sometimes the filler can migrate depending on what filler's put in, that you can get the wrong shape. I think you need to send some pictures in. Good. Okay. Comments on preservation. Which kind? Okay, preservation rhinoplasty.
That's a good question, actually, because it's a bit confusing. I always feel it's confusing for professionals, let alone for you guys. Preservation has 3 different meanings. Dorsal preservation, which is preserving the dorsum but making the nose smaller. Ligament and soft tissue preservation, that is a technique that we use pretty much for all the rhinoplasties, wouldn't you say?
All the primaries,
so
yes.
A type of preservation is now very much used for all the rhinoplasties and the skin, in fact. So dorsal preservation, probably is the question you're asking, is when it's an overprojected tension nose. That's the best indication. So that a lot of people that I like myself in the front view, but on the side view they have an overprojected nose, which means it sticks out too far from the face. That's the best indication for preservation rhinoplasty in a primary case.
How much does it cost to have both of you in surgery? Well, it depends what you like, Queenie.
It's more to do with the complexity of your operation than it's not double price, basically.
Yeah. What do you think about Isabella? Well, minimum experience with that. You mean for taking the fat out from underneath here? I think.
We don't have a lot of experience with Isabella.
Probably best not to really comment on that here. For fat, yeah. I mean, it does work. It has an effect. There's no doubt. Deviated septum suffers sinus. Sinusitis is not usually related to a deviated nasal septum. There's usually something else that's going on, like an allergic or a blocked drainage pathway from your sinuses. So you'd need a CT scan to have a look at and assess that. That'll tell us about the septum and about your sinuses. We can arrange those for you. Okay, so anyone who's had surgery with these lovely people, I'd like to hear your experiences and pictures. It's going under scares me. So I'd love some advice. Yeah, great. Okay, I do think that's a great thing for social media, is that patients can actually liaise with real people who've gone through this, and rather than being taken in by glossy websites or offers or
yes, please do.
Being seduced, do speak to. I mean, most of our patients who are happy, and some of them who are not, are still very happy to converse. So I think social media is a great way in which you can just build up that confidence and understand a little bit more, so you don't have this terrible fear.
It happens to a lot of people, actually. Having an operation is something quite scary, so all of us have to be quite brave in going forward. Well,
we would like to just draw this to a close because we're coming up right to the end of our allocated time. And for something which we've never done before, I've thoroughly enjoyed this. It's been actually great fun. And we may ask whether you would find it helpful for us to do it again, perhaps in a week or so. So we might send... We were thinking about perhaps sending out a little message about questions that you may want to ask, and we would then tally those together and probably go through in a bit more detail the top 10 responses. Anyway, we'll think of something to... hopefully keep you educated and entertained and us amused too. And go through this difficult time together. It feels really nice to be connected at some level. Yeah. Anyway, it just remains for Lydia and I to say it's been great to do this, and I'm very, very pleased that we were able to get in touch with you. Please don't hesitate to contact us. Thank you for your time tonight. And stay safe, everybody. We'll get through this, don't worry. Bye-bye. Bye.